Hi viewers, this is Dr. Varun, consultant endocrinologist at Magna Centers, Bangalore. In this video, we are going to discuss regarding diabetes and feet, how diabetes affects your feet and what can be done about it. Excess blood glucose in patients with diabetes tend to affect the nerves, affect the blood vessels, affect the sweat glands by decreasing the sweat production in the feet, leading to at-risk foot, increasing the risk of ulceration. So, what can we do about it? So, to understand how we can prevent these diabetic foot-related complications, it is important to understand how it happens. So, in patients with diabetes, this excess glucose causes something called as neuropathy, damage to the nerves. So, a patient with diabetes, long-standing diabetes leading to neuropathy, so they will not feel small cuts or bruises, which can, and by the time patient notices these cuts or bruises, already it will be widespread with some infection also. And in case if some cut or like some wound happens to these patients, since there is no proper blood supply, healing takes longer time. And since as I have told, like it also affects the sweat glands by causing dry feet, the risk of damage to the feet is more, or the even smaller, the normal repair mechanism of the feet tends to be poorer. Now that we understood why the patients with diabetes are at higher risk for these foot complications, how can we prevent these foot complications? So the important aspects of managing feet in patients with diabetes are self-inspection of feet at regular intervals, keeping a healthy feet by cleaning it regularly and also using moisturizer, and also keep trimming the toenails regularly. And in case if any signs of infection are there, it's important to meet your doctor at an early stage. First, coming to the daily inspection, it's important to check your feet for any thickening of skin, something called as calluses, any cuts. It's especially important to check near your toenails and also between your toes for any signs of infection. It's important to daily keep your feet in lukewarm water for a short amount of time, and then dry your feet and apply moisturizer on a daily basis, so that you will not be getting any cracks in your feet, which can be nidosus for development of an infection. And while cutting your toenails, it's important to cut the toenails straight, especially towards the corners. If you cut too deep, there can be risk of ingrown toenails. At the same time, if you keep the edges very sharp, you can injure yourself. In addition to the general care, footwear plays an important role in terms of prevention of these foot complications. So it's important to wear well-fitted shoes, or sometimes sandals also can be used in some patients, especially when they're not able to find proper footwear because of foot deformities. Although we can always use customized footwear, especially for patients with deformed feet. So patients with diabetes, especially because of neuropathy, can have deformed feet, like with claw nails or hammer toes. Okay, in such patients, it's important to use customized footwear. Other patients, it's important to use well-fitted shoes with wide toe space and a soft sole, which for diabetic patients we use and we suggest something called as MCR footwear. A sole composed of multicellulose rubber, which is the softness or like hardness of the footwear is perfect for patients with diabetes, so that the pressure in these patients will be distributed evenly and they will not develop any ulcers over a period of time. So in addition to all these precautions, it's important to be physically active. Doing good amount of like physical activity tends to decrease the risk of falls and decrease the risk of injuries. And whenever the patients with diabetes are going for like physical activity or walking, it's important to wear proper footwear. Even we suggest patients with some degree of like neuropathy and who are at risk for these complications to wear footwear at home also. Thank you for your patient listening. Stay tuned for further updates.